Hi, and welcome to the Restorative Wellness Clinicians Corner, a video series exclusively for functional health professionals, where we interview the top experts in the latest research, products, tools, and best practices for getting your clients exceptional results. Biological periodontist, Dr. Sanda Moldovan. Dr. Sanda is a distinguished periodontist and nutritionist, renowned for pioneering approaches in natural oral health and wellness. She's the owner of Beverly Hills Health and Dental Wellness, and she also founded Orasana, an oral health product line. She's an advocate for microbiome testing and nutritional therapeutics in dentistry. Dr. Sanda educates professionals and the public alike. A popular speaker and media personality, she hosts the Holistic Dentistry Show podcast, and she's authored Heal Up: 7 Ways to Faster Healing and Optimum Health, promoting holistic wellness. Welcome, Dr. Sanda.
Thank you so much, Margaret. It's nice to see everybody.
Oh, I'm so excited to be chatting with you today. You know, it's oral health is a topic that comes up a lot. We got a lot of questions about it in the different classes, and I'm really excited to dig in with you because, you know, we know the very much a big, wide world here, and I think there's so much opportunity to support our clients in this way and to learn from you. Now, I would love, you know, I'd like to start off by getting to know a little bit more about you and your background. And I would love to know what inspired you to pursue this, what I consider a very unique combination of periodontistry and nutrition. So share with us about where that all came from.
Yeah, it all came from my struggles with my own health. That's how it really happened. And I finished my residency at UCLA in periodontics in 2004, and I wasn't feeling very well. You know, I had these I had some chronic fatigue that I was dealing with, some, headaches. So I stumbled upon an Institute of Functional Medicine. And I started learning about, mercury's being not safe. And I'm like, oh my God, I think I did not have mine removed safely. I had 16 large mercury fillings in my mouth at one point. And when I was in dental school, I decided to remove them. But I didn't know about safe mercury removal. So it made me very toxic. I had high levels of mercury for years. It definitely took me years to chelate them. And then also, Institute of Functional Medicine started talking about cavitations. I never learned about cavitations in school either. So I wanted to learn more after I finished my residency. There was so much left out. So I got a CMS degree through American College of Nutrition. And I went to Switzerland, spent some time there with the doctors who are practicing biological dentistry in Europe to learn how to do cavitations properly. What are cavitations? What do we do? And then when the microbiome studies came out, 7, 8, 9 years ago, I really was fascinated how, probiotic studies were showing that we can have improvement in gum health and the rate of cavities, even in the way our taste buds, activate just based on a healthy level of microbiome. So I became fascinated with that, and I started a line of chewable probiotics because the ones that were on the market were horribly tasting. So I tried them with my patients, and nobody wanted to take them. So I said, okay, fine. I found a chemist in Wisconsin, so we worked on a formula that's now in some of the natural retailers here around in Southern California. Mm-hmm. And yes, that's basically what I do in the practice. Now we have 3 locations here in Southern California. We have 2 other biological dentists that I work with, and a prosthodontist and a chiropractor to help us with adjustments. And yes, it's been a journey.
Yeah. Well, so let's talk about the oral microbiome very specifically, because I think that's a really good place to start. We do so much gut testing. We're very familiar, of course, with the gut microbiome. Can you help us make that connection between the oral microbiome and our overall systemic health? You shared that recent review that you did, and there were conditions as diverse as neurological conditions, cardiovascular disease, adverse pregnancy outcomes, even cancers that were linked back to the oral microbiome. So can you help us unpack that?
Definitely. So, a lot of patients that you might be seeing have bleeding gums. As a matter of fact, statistics show that 80% of the population has some form of gum disease, whether it's a local area, whether it's, generalized. And this can be from children to adults. And it's important, I think, to ask them as a healthcare practitioner, ask them simple questions. I would say, do you have bleeding gums? Are you prone to cavities? Do you have root canals? Why is that? Because all these conditions that I mentioned are related to the microbiome of the mouth. Bleeding gums, what happens is anytime somebody's gums are bleeding, whether when they're flossing or brushing, bacteria can enter from the oral cavity into the blood vessels, and it kind of catches a ride in the body. Our immune system is not perfect. Sometimes it can scavenge this bacteria, but oftentimes it basically lodges in different places. How do we know this? Because studies have been done. There's been biopsies on cadavers that have had heart attacks, and we found actinomyces bacteria, which is one of the more aggressive periodontal pathogens, onto heart valves. So we know that periodontal bacteria travels. Another one that's big for us is called Porphyromonas gingivalis. Dr. Dale Bredesen talks about this. Why? Because P. gingivalis, we call it a stealth microbe. It causes gum disease and bleeding gums, but it also can cause cognitive decline. So people with brain fog, it's involved in Alzheimer's, and is also involved in joint pain. It's been linked to rheumatoid arthritis. Wow. So, gum bleeding, even though it doesn't hurt, it can be a problem. And how do we test for this? Or, I can wait for you if you have a question.
Yeah, well, I have a question about this just before we move into testing. So it seems like the bleeding is both a sign and symptom of an imbalance in that microbiome, but it's also basically the vehicle for actually having that bacteria travel into the bloodstream. Am I understanding correctly? Because we don't have a leaky mouth, or maybe we do have a leaky mouth. And I think about this.
Yeah, I say that leaky gums, leaky gut. That's really it. It's leaky gums. Because what happens is that inside the periodontal pocket, so around each tooth, there's a little bit of a space. Mm-hmm. So the gum in that area, if there's inflammation, it's got ulcerations. Mm-hmm. So those attachments are open, they're more enlarged, and we typically see more lymphatic fluid flowing around the teeth, more crevicular fluid, we call it.
Okay. Mm-hmm. Interesting. So then the mechanisms here, I mean, you've mentioned all sorts of different things. So definitely inflammation being a very key mechanism. Is there a connection as well between, I'm assuming, between oral microbiome and the gut microbiome? And my understanding, which is very cursory, is that they both influence each other. The oral microbiome is influencing the gut microbiome, but the gut microbiome can also be influencing the oral microbiome. Is that correct?
Well, I work with quite a few integrated practitioners in my area, and typically they do stool tests and they find microbes that cause gum disease in the stool. So then, one of them being Fusobacterium. Fusobacterium nucleatum is one of those bacterium that can actually has been linked to tumors in the digestive tract, in the intestinal tract. And it also is one of the moderate pathogens when it comes to gum disease. So if that's in high numbers in the stool, most likely it's coming from the mouth, because as people are swallowing, right, if there's bleeding or they're swallowing bacteria, it goes down. Now, whether or not the gut microbiome influences the mouth, it's hard to tell. It's easy for bacteria, right, with gravity and with swallowing, it keeps going down into the GI tract, but can it influence the other way? We don't have enough evidence to know that's okay. True. Mm-hmm.
Okay, very interesting. Now, so I guess it sounds like we should be asking pretty much every client that we work with if they have bleeding gums. if they've had cavities, if they have had root canals. This just should be part of every intake. It's not something that, are there other things that when we hear it, so you've said things like brain fog, rheumatoid arthritis, moving into Alzheimer's, like if we're working with a client and we're hearing about these things, we should pay extra attention to the oral microbiome as well. Is that the case? Are there any other pieces, or should we just make this as part of what we ask every single client?
I think it's a great idea to ask them, are your gums bleeding? And if the gums are bleeding, okay, well, what are you using? Do you brush? Most people might say yes. Do you floss? And you might find a lot of people will say no.
Mm-hmm.
So just giving them certain, and if not everybody can afford to go see, a biological dentist, even though we highly recommend it, you can give them like easy steps. And I have some videos online that you can refer to how to clean their mouth at home, which I think is so important. So definitely, brushing is important in small circles. Secondly is water flossing. I think a lot of people hate string floss. It's just a reality. Most people, just can't, especially if they have this dexterity problem. Let's say they have arthritis. Now their hands hurt and we're asking them to use string floss. It's
Right.
not practical.
Right.
But the good news is that actually the water flossing studies really show that it actually decreases inflammation a lot better than string floss. So just having them use a water flosser with just water, they don't need to buy mouthwashes. And the thirdly, I highly recommend usually if the gums are bleeding, like a probiotic, oral probiotic for the mouth that they can let dissolve in their mouth. And we have good information that helps to decrease the cytokines as well as decrease bleeding and decrease cavities and bad breath. So it really helps to like regulate the microbiome.
Absolutely. So let's talk about testing. And I see that Linda has asked about Bristle. That's a company that we've learned about recently, and other oral microbiome tests. Talk about that. Is this something that we should be thinking about? Is this something that we should be referring our clients to a biological dentist to do? I know that some of these, like Bristle, for example, probably the oral DNA that Linda's asking about as well, they are, I think they're direct to consumer. So anybody can get access to it. What do you think about those kinds of tests?
Yes, Bristle, I would say it's a latest one of the testing. The reporting is not that great. They include way too much bacteria, and we're only really interested in the pathogens.
Mm.
We really we can't make sense also of everything that's on there. But the test that I use and I have been using for years is the oral DNA testing,
Okay.
not the Bristle. And this is something that, depending on the state that you're in, you might be able to just order it, create an account, a health practitioner account, because all there is a saliva test.
Okay.
So it's easy to do. Typically, we have patients do it in the office. They come in with the pockets, and then we give them a swish. It's like about a 30 to 60-second swish.
Okay.
They spit back in a test tube, and it's only saline that they're swishing with. And then we send the test tube back to oral DNA, and we get a report in about 5 to 7 days. And that report, I like two things on it for people suffering with bleeding gums. One is the 11 different pathogens that can cause gum disease. So I don't want the entire spectrum.
Right.
Because everybody has a different bacterial fingerprint when it comes to a biofilm. That's why I think it's hard for us at this point to make sense of all the different microbes, the 600, 700 species that are in the mouth. So I'm interested in the 11 different ones that we know cause systemic issues as well as gum disease. And then the second thing that I like on there is an IL-6 genetic marker. And why IL-6? Because for us, if people have a high expression of IL-6, we know they're going to get more bone loss than people with a low expression of IL-6. So those are the two things that I like to test in the saliva. And of course, we can do other tests for oral DNA if they have candida and cavities. We can test other things.
Now, are these situations that, nutrition professionals, which we all are here, are able to address with something as simple as an oral probiotic. Or if we find something like, let's say we do either the bristle or the oral DNA, and we see some elevated levels of these pathogens, is that sort of the, okay, now it's the moment that we refer you to a biological dentist?
Yes, and I think everybody treats things a little bit differently, but definitely ozones. The biological dentists use ozone for these microbes, and some of them can be pretty resilient. But I think having them do 3 steps, right? Not just a chewable probiotic, but having them brush correctly. And I'm happy to share the video with you and send you the link of how to brush, water floss, and then pop in a probiotic. I think it has to be the 3 steps. Like I always say, a pill will never cure anything. Really, it's really the lifestyle choices and the way we do the hygiene at home. I think that's hugely important. We do have some studies on our patients that have followed these 3 steps, and we've seen them reduce periodontal pockets and bleeding in 2 weeks. That's how fast, if they start to use the 3 steps, that's how fast we see them reverse bleeding. Because gums, cellular turnover of the gums is basically every 3 days we get new gum cells, which is pretty amazing. That's why also it's in one place, right, that we get oral cancer as well, because of that fast turnover. So, but the good news is it heals fast. So as soon as they're starting to use the right tools, they're going to definitely feel a difference themselves.
Right.
Yeah.
And so these oral probiotics, and that's one of the products in your Orasana line?
Yes. All 3 of them. The whole thing, like, brushing with calcium hydroxy, like no fluoride necessary.
Yeah.
The calcium hydroxy upside, a water flosser. We actually have this whole package that, we have an affiliate link for. So if you guys are interested, you can sign up for an affiliate and we can just drop ship it to the patient so they can. I think that's an easy thing to get them on a good regimen of oral hygiene. That's the one thing that's so needed, because most people don't know how to brush their teeth even.
Right. I'm gonna put I'm gonna put the info you guys shared with me here. So here you go. Here's an application to be an affiliate. I think that's super helpful to have all of that. It's really interesting. I saw Ellen Siverson mentioned up here. She said that loves water flossing. Since I've done this, I have no bleeding. And it's really encouraging to hear that these things that are actually really quite simple can make such a significant difference.
Absolutely. Yeah, and the water flosser can get up to 6 millimeters under the gum. That's the nice part about it. So it can really clean deeply. And I always tell people, when you first start using a water flosser, especially after you haven't flossed for a while, the gums can throb a little because you're finally cleaning. So, you might say, you know what, my gums are actually sore. It's okay. It'll go away in 2-3 days, pretty fast.
And how young do you recommend this? Like, would you recommend all of this for children as well?
I do recommend it for children, but they have to be old enough to be able to hold it. So I would say, and they have to get some permanent teeth. So 8 years old is when we start seeing permanent dentition. Yeah, so I would say 8.
What do you think of toothpaste and products? I'm thinking of, with the line of like dental Sidon, in that biocidin line. What are your thoughts in terms of those kinds of several of these on the market now? It's the one that's coming to mind right now that I'm the most familiar with, that are sort of pitched as manipulating the oral microbiome and breaking up biofilm and things like that.
I like dental Sidon for people that have gum disease. I think it's definitely helpful. We do see nice results with using dental Sidon. And, it doesn't have any harsh chemicals. So I think it's an aloe vera based with essential oils mouthwash, toothpaste. Yeah.
So let's then talk about cavitations, root canals. I see some questions in the chat about this. That's something that we're all very aware of, that with these kinds of, there can be these sort of silent jaw infections. And we know that this is often overlooked in conventional dental practices. So can you share a little bit more about the impact of these on systemic health? And maybe it's the same mechanisms, but also what signs we should be looking for when we're talking with clients. Is it anybody who has had cavitations or root canals, or is it are there certain things within that kind of a subset of that population that we should be paying more attention to?
So the recommendation with anyone who's had a root canal or a tooth removed is to get a cone beam CT scan, because that's the only way for us to really see it. And this has to be done in a biological dental office. It's not the medical cone beam, CT scans. Nowadays they have basically a CT scan has as much radiation as holding your iPhone in your lap for 2 days.
Okay.
You know, so it's like we've come a long way with that because they're digital. But on the two-dimensional X-rays, we only see about 52% of dental problems. This is studies done to see how good, you know, what we can see. And I have a lot of patients that come in, oh, you know, I have pain here and my doctor took a regular dental x-ray. They don't see anything. Sure enough, I take a CT scan so I can see inside and it's a big infection or a cracked tooth or, you know, so we need to see, and today we have the technology. So the standard of care for our practices, anybody who's had a root canal or a tooth removed, a CT scan is done in the initial appointment. That's
And
the only
even
way to diagnose properly.
so for things like wisdom teeth removal and that kind of thing as well.
Exactly, because we want to see how big the cyst is around the wisdom tooth, how close it is to the nerve before I remove it.
Okay.
And the problem with a root canal is the fact that it can hold bacteria in it.
Right.
Studies published so that a root canal treated tooth on an average has 50 times more bacteria inside it than a healthy tooth.
Yeah.
That's the issue with it. And I myself had a root canal at the age of 14. So I had lived it all, right? I had mercury fillings, I had a root canal. So unfortunately I lived it. For me, it just, you know, once I became a biological and my practice was holistic, I every time I flossed this tooth, it gave me a smell on that root canal. And I looked at it and I could see it turning black at the gum line.
Oh.
But in the bone on the CT scan, it looked like it had no problems. So I still decided to have it removed because simply just my intuition and the smell and everything, I'm like, I'm going to get this out. So I took it out. It happened to be a molar, a lower molar. I didn't take it out myself. I had a friend do it. So I would have loved to do it myself. What's interesting is like my digestion improved.
Oh, wow.
And I actually had some heart palpitations that went away after I had this tooth removed. So I think the fact that it was turning dark, the fact that it was smelling, you know, it was enough evidence for me that, you know, it's infested with bacteria. And yes, my immune system was keeping up with it because I was doing a lot of good things for myself. But at the same time, even today, I think that that situation of my own helped me guide patients today. Like if I see a tooth that's turning black, and even though it has no radiographic bony changes, like a big abscess or anything, I would still recommend it to have it removed because it's just, once it's infested, bacteria has entered the tooth, there's just no way for us to get it out.
Right.
Because there's so many pores and micropores and little channels inside the tooth. And that's the limitation we're having today.
Okay. Okay. Now, as nutrition professionals, what can we be doing to support our clients as they're going through this? Are there things that we can do from a nutritional perspective? I mean, I'm assuming the obvious things of moving away from processed foods to, you know, real whole foods. Of course, we are going to be supporting gut health and, you know, systemic health overall, but are there specific things that we can be doing when somebody is, you know, dealing with a root canal like this or something?
Well, I think if you know that one of your clients is seeing a biological dentist and they're about to have a tooth removed, they're going through cavitations, is really supporting the healing process. I think initially, you know, these kind of procedures can be, and maybe some of you have experienced an extraction or tooth removal. It's not a good time to detoxify. And that's why people always ask me, oh, can I like fast? No, your body needs to heal. We can't detoxify and heal at the same time. You know, it's either one or the other. So when right after surgery, it's good to support them with good protein intake, good antioxidants, because I am causing a lot of oxidative stress for a surgery. So just support them to have like a well-rounded nutrition, And once they're healed, that's when you start the detoxification.
Okay. I want to talk about the detoxification piece. You talk about full mouth detoxification, and I want to know a little bit more about what that is and when we should be thinking about it.
So, I really believe the mouth is the one place that, we typically don't look as nutritionists or, even physicians. There's a lot of physicians that still don't believe the mouth has anything to do with anything. So it's just, what do we know today is like the least amount of toxins and infections we have in the mouth, the better we will feel and the less inflammation we'll have overall. So full mouth detoxification involves looking at the microbiome, jawbone infections, and any kind of toxic fillings or crowns that we might have in the mouth, that really kind of removing everything and restoring everything to a biocompatible state, meaning metal-free, BPA-free fillings, healthy microbiomes with gums that don't bleed, and definitely no jawbone infections. That's kind of the ideal scenario. And unfortunately, we're undoing a lot of things that traditional dentistry did, that we didn't know. Like dentists, 20 years ago weren't thinking about, even today, like an extraction is like 5 minutes sometimes. You put a piece of gauze there and no stitches. And unfortunately, there's lots of bacteria, the anaerobic bacteria that gets trapped in there that continues to live. So we're putting mercury fillings. Sadly, mercury fillings are still FDA approved in this country, and there's still a lot of mercury fillings being placed on young children. Yeah. And yes, it's about, I think, education, and that's one of the things I'm trying to do, to just make healthier choices for oral health. I think that's the key.
Well, let's talk about the mercury fillings, because that is the story. You have the experience of having a lot of them removed improperly. And that's something we definitely are talking to our clients about, asking if they do have any mercury fillings. But then there's that, okay, well, what do you do? And how do you know if the dentist that you're working with knows what they're doing, right? Because it can be even more problematic to mobilize all of that if it's not done properly. So what are your recommendations for like the most important qualities to look for in a dentist who can do this safely? And conversely, are there any red flags? Like if they say this or they suggest this, like run.
Yeah, good question. I think it is important to be trained to properly remove mercury. IAOMT, who is our Biological Dental Association. It's an International Association of Oral Medicine and Toxicology. I think it's IAOMT.org. They actually certify dentists to remove mercury safely, called a procedure called smart removal.
Okay.
So through the smart removal, basically dentists all follow the same protocol, which has been proven to protect patients and our team as well from inhaling mercury. So this involves putting a little rubber dam, a little protection around the tooth. There's a big suction that's about 6 inches wide that sits in front of the patient to suck up the mercury vapors, which are odorless. And there's a lot of mercury flying in the atmosphere when a filling is cut into.
Right.
So it's finding a dentist who's smart certified is important. Now, how good then, the dentistry is afterwards, that's another story. I mean, they just have to probably ask or what's their process. So definitely ask them, do you use BPA-free fillings? There's great dental materials today coming from Germany that are filled with ceramic particles. So they're much more resistant over time, much more durable, and they can be BPA-free. So I would ask them that. Do you use ozone? I think ozone is an important thing to use when removing mercury fillings. Why? Because ozone really helps us to detoxify, and it's even through the tubules past what we can see with the naked eye. For those of you that might not be familiar with ozone, we use ozone in dentistry in form of water as well as gas. and we use it as gas after the cavity has been removed, and it really helps to penetrate in the tubules of the tooth, and it helps kill any remaining bacteria from that cavity before we seal the tooth again. If they're very deep cavities, it's really helpful to find a laser dentist, because lasers actually are much more gentle to clean the cavity when it's next to the nerve than drills are. The drills, they rotate very fast, and in that rotation, they kind of throw all this cavity inside the tubules.
Right.
Lasers don't work that way. They actually slowly remove things. So we have much better success using lasers in deep cavities.
Okay.
Yeah. So, but the important things are, I think, being smart certified and using ozone, and definitely having the ability to do onlays, not just full crowns. And why is that important? Some of you might not be familiar with inlays, onlays. It's like ceramic filling. So instead, sometimes the mercury fillings can be pretty large. And dentists like to recommend, okay, well, it's easy. Let's just do a full crown on the tooth. But then we have to shave the entire tooth. There is a way to do shave only partial of the tooth, whichever part is damaged, and we call that an onlay. So it's kind of like a partial crown.
Okay.
It's a lot gentler on the tooth to have this kind of restoration instead of doing like a full shave around. So having a dentist that does that, I think it's very important.
When it comes to timing of removals, you said you had 16 to remove. Is it, my understanding has been that it's a good idea to space these out, not necessarily to do all 16 at once. I've heard of some dentists, doing it in a very specific order, depending on the meridian for the different teeth. What are your thoughts on the pace and the order?
Yes, I think, Margaret, it's important to do it per sections. So we usually divide them out in 4 sections. Like for me, I only did 4 at a time, because those 4 took 3 to 4 hours.
Right.
Because we have to go slow. You don't want to burn the tooth, so you don't end up with a root canal, even though sometimes it's unavoidable. I had a tooth that died actually just a couple of years ago. I was just replacing a filling with an onlay, and a year later, I took a random CT scan and the tooth was dead, right? And I didn't even have any symptoms. So that's why I think it's also important to take regular checkups. So I ended up having the tooth removed, but it's really critical to just work with dentists that can take these scans and keep an eye on things. Yeah.
So you're recommending that if in the 4 sections to do 1 section at a time. And there's how much time in between? A couple of months, couple of weeks?
Yeah, so I would say it takes us about 2 weeks to put. Sometimes it can be done the same day, depending on how deep the filling is. But on an average, it takes us a couple of weeks to finalize one side.
Okay.
For the bite to feel comfortable. And the teeth might still be sensitive. Now, if you're experiencing sensitivity to cold, when chewing, you might want to give it a little bit of time and not rush to do the other side.
Okay. And then, with this piece, I'm assuming, as again, nutrition professionals supporting clients going through this, are there things that we can be doing with them to help support them through this process, both, before and after, and even during the extractions process?
Definitely. I think it's important to give them something to support to start the detoxification. This is not something that they have a lot of downtime. So I think bringing anti-inflammatories on board, such as curcumin, I think that's a great supplement that's anti-inflammatory. And curcumin also helps with the detoxification process.
Right.
Chlorophyll is a great one. We like chlorophyll for the oral cavity. Of course, mouthwashes is something that usually the dentist does, but supporting them with, an anti-inflammatory diet and mercury detoxification. It's good. Like chlorella basically,
Yeah.
products. Like cilantro, things like that.
Great. Great. Okay, I'm gonna switch gears a little bit here, and I have a question that my 11-year-old daughter has begged me to ask you.
Okay.
She is, and I'm sure others have seen this too. I mean, there seems to be this complete obsession with teeth whitening products, pastes, purple things that you smear on your things. The red light. There's so many different products for this. And what are your thoughts and recommendations on this? I'm sure some of them seem too good to be true, and they feel like they must be just stripping the teeth in some way. I'm not sure. I honestly don't know the mechanisms of any of it. But what would be your recommendations for teeth whitening, just from a purely cosmetic perspective, that are natural and effective?
Yeah, this is a great question because we want a bright smile.
Yeah.
It's totally normal, myself included. So a lot of the products out there are based on hydrogen peroxide at different concentrations. Now, hydrogen peroxide, if it's just, let's say, like the white strips, Crest white strips, if you use
Yeah.
them like once a week or something, they're not damaging the teeth,
Okay.
especially for people that don't have dry mouth. Like, if you're 11, no problem. I'm sure she doesn't have dry mouth. So Chris white strips actually work pretty well. There's also some of the pens that are like in the 3% range hydrogen peroxide, and I think that's safe to use. Now, higher level hydrogen peroxide than 3%, we don't want to use it on a regular basis on the teeth because that can create too much porosity in the enamel itself.
Okay.
What I like to tell patients to do after hydrogen peroxide use, and in that 3%, is use calcium hydroxyapatite. And or in our Asana, we have the tooth powder that has calcium hydroxyapatite. So what calcium hydroxyapatite does is actually, after the whitening, it plugs in the pores. So it makes the enamel stronger. And studies have shown that when brushing with calcium hydroxyapatite, the teeth are brighter. And we think that's why, because it actually plugs in the hole so that we don't pick up stains as readily.
Oh, interesting. Okay.
Yeah.
Excellent. I see lots of questions here from the community, but I have one more question, and then I'm going to open it up for all these great questions in here. So another thing we see a lot of is things like those little silicone chewy things to like exercise the jaw. And I know that, James Nestor's book, Breathe, he proposes this idea that we're not developing that oral cavity sufficiently because we're eating such soft foods and not chewing, robustly like we should be. What are your thoughts on that? And are these kind of jaw exercisers worth it, effective, helpful, harmful?
Yeah. Yeah, I really like that he put breathing on the map, because that's a big problem when it comes to breathing. I think there's a lot of dentists that are checking for airway health, and that's something we can definitely go deeper into.
Yeah.
Some amazing procedures today that we can open up the airway. But when it comes to these chewing rubber things, it's it's really, where did that come from? Weston Price in the 1920s or 30s, he actually studied the development of the jaws, and he noticed that people that eat more fiber, they have nicer jaws. However, it's the generation before them, because what sets our genetic tone now is the generation before. We're not going to develop jaws, especially in our adult age. Can it shift a little bit? Yes, but not enough to open up an airway, or not enough to make room for third molars. So I think it really starts with the previous generation, and also it's eating that fibrous diet early enough in life, like starting really young, and then continuing that. And I think that helps with jaw development in the growing years.
Right.
Yeah. So especially people that have now maybe crowns or root canals on the back teeth or brittle teeth, now you're going to start chewing and exercising, with these rubber. I don't think that's really highly recommended.
Yeah.
Yeah. So, yeah, I would advise against it.
Okay.
Just the fibers
part of my question. Is there a time when it's too late? And it seems like yes. And it's interesting how much the generations, will affect things so significantly.
Yes, for sure.
Ananya is asking, if we live in a country without access to a biological dentist, so she's in Thailand, what would be your recommendations for safe mercury amalgam removal, or should we remove it at all? Root canal implementation and root canal treatment.
Yeah, that's a good question. You can ask the dentist to use a rubber dam, and an oxygenous mask. That's like, I would say, the minimum to have it removed. And it all depends. Sometimes it's better not to remove it than to remove it without any protection at all, because it's harder to chelate it out of the system. But in dental school, it is taught how to use these rubber dams. And everybody has an oxygen mask, probably even in Thailand, they would have that. So at least that's the minimum, I would say, to have it removed. The problem with mercury fillings, and this is actually something that happened to me, one of them cracked my tooth. So it expands with time, it picks up water. So if you have really large mercury fillings, with time, it'll crack the tooth. I actually have an implant now where I had that large mercury filling for that reason.
Interesting. So Ellen is asking, and we just kind of answered this a little bit with respect to whitening, but she's asking about hydrogen peroxide rinses and electric toothbrushes, and also Stimudent in addition to the water flosser. So we talked about the hydrogen peroxide, but let's touch on electric toothbrushes versus a regular toothbrush. Do you have thoughts on that?
Yeah, there's lots of science on it. We have a lot of studies on electric toothbrushes versus manual. The electric toothbrushes clean better for people that have they don't have good manual dexterity. Let's say people with arthritis. However, there's a difference between sonic brushes and rotary brushes.
Okay.
The rotational kind of brushes, like an Oral-B, people with thin gums should avoid them because they can bring on gum recession. So, but the sonic brushes are safer, and they tend to clean better. However, I find that with a lot of my patients, manual brushes do just as well. Because some people, get lazy about having an electric brush and then they just move it around, and it doesn't clean well at all. I'm like, are you sure you brush your teeth?
Right.
It depends on the technique, whichever tool. So the studies are mixed out there with electric versus manual. It depends on the technique. If you're using a good technique with your manual brush, just stick with the manual.
Okay. And what about Stimudent in addition to the water flosser?
We don't find that you need to do both. Probably the Stimudents are made out of wood, some kind of wood picks, and this is the problem with them. You have to be careful. If you put them too much in between the teeth, it can open up the space there. So now we call them a black triangle in between the teeth, so that where food can accumulate. So if you're a bit too aggressive with the gums, they can recede as well. So there's a fine line between brushing enough or brushing too much.
Right. Here's a question about root canals. So Alan says, I have 2 root canals from a major bike accident in elementary school. Having this replaced could be a major undertaking. If I can't afford to deal with this, what do you recommend?
Number one is taking a cone beam CT scan. And somebody's asking, what is a scan? It's essentially a machine we have in the office. You stand holding 2 candles, and it goes around your head. And it just takes basically an image from just under the eye to just under the chin. So we can see an X-ray in 3 dimensions. So I would say I would start with that because I don't know what you need. If your root canals are looking fine, maybe you can just buy some time with ozone injections. It's hard to tell, but it depends on also, the symptoms for the patients. A lot of my patients with root canals have brain fog, they don't feel well, they have chronic fatigue. So yeah, it all depends. We have to look at the whole picture, but at least I would say to get a CT scan.
Are there good alternatives to root canals if somebody is needing that? Or is sometimes just a root canal all that you can do?
Yes, there are alternatives. Like the problem is a lot of dentists still recommend preventative root canals. So meaning killing a tooth just so you don't have pain, possible pain, which I think it's so wrong to tell people this. So, because I know my patients are coming to me like, I asked him, why did you get a root canal? Well, the dentist said I need it. Did you have pain? No. But he just said I might. So I might as well do a root canal.
Oh my
Yeah,
God.
so we always try not to do that. So I think just if the dentist tells you need a root canal and you're not in pain, or maybe you just have some sensitivity, it's okay if you have sensitivity. Um, Tooth is alive. That sensitivity can go away. Like I had a crown that was placed on my upper right, and yeah, it was sensitive for about 6 months, but it went away, and that was like 12 years ago. My tooth is fine. I'd rather deal with the sensitivity. There's some homeopathics that are great for sensitivity. And eventually, teeth heal. It's one thing to remember is that teeth heal.
Yeah, 100%. 100%. Okay. Good question here from Teresa. Is there an online database to find certified dentists? I'm assuming certified biological dentists. Like, is there a resource to find people who have been trained like you?
Interestingly, every dentist practices a little bit differently. Every biological dentist practices a little bit differently, so especially when it comes to the microbiome. But I think, we have more and more people. I'm going to start creating like a database for people that come through my microbiome program soon. So, I will share those with you as I open them up to the public.
Yeah.
But for now, I would say the best place would be iaont.org.
Okay.
And
that was the same place as you suggested for the mercury.
Exactly. An IBDM. However, if you call probably 5 dentists on that list, they're all going to be different. So it's just a matter of asking them questions, doing your research, and seeing, who you resonate with.
Right. Isn't that the state of functional health overall? Doesn't really matter. We all have sort of slightly different ways of doing things. And
so true.
It's both a beautiful thing not to have standard of care and also the total Wild West out there.
Yeah, exactly.
Is it okay to use composite plastic for a dental filling, or should we be requesting ceramic even for a very small part?
So there are BPA-free fillings that, they're 70% filled with ceramic. Those are still considered fillings. So you can ask the dentist to use a healthier filling. The filling, that material that we like to use is a company called Voco. It's a German company, but they have distributors here in the US. And the product is called Admira, Admira. So it's a great white filling material that's filled with a ceramic. Excellent. Yeah, so I think it's important to know, whoever asked that question, it's a good point. Know what's going in your mouth. A filling is not a filling. We have hundreds of filling materials. So it's important to ask, what kind of filling are you using? And dentists will find the cheapest material out there, especially right now. A lot of dental practices, the overhead has gone up, salaries have gone up. So some of them might be looking at offering, finding cheaper materials in order to meet their overhead. So it's important, I think, too. Yeah, even let's say if you need to pay a little bit extra to get something different, it's definitely worth it.
100%. Mandy's asking about remineralization. Do you have any suggestions or strategies for that?
Yeah, the teeth can heal. We can remineralize cavities, especially if cavities are only in enamel. So once they've gone past the enamel layer into the dentin, we can now mineralize. But into enamel using calcium hydroxyapatite, and that's a nano format. We've had studies to show that we can actually have the enamel get strong again because teeth are alive. And this only happens in teeth that are alive.
Okay.
If root canal treated teeth, then we don't see mineralization happening. Yeah. So typically I like to test for pH in the saliva. And this is easy to do. You can do a pH test strip. You can easily find it, online. I like the one that's dual colored. Have the patients test. If they have a really low pH, like 4.5, 5.0. We know that's a problem with their, systemic health as well, but also it's bad for the teeth because teeth demineralize at that pH. So we usually want a pH around 7, 7.5 in the mouth.
And so you'd be addressing that by addressing the diet as well as the appetite.
Exactly.
Okay.
Yeah. Very important to find out what is the root cause. Like, where are they getting all these cavities?
Right.
Typically, it's a very acidic pH. It's they're not maybe cleaning properly. I mean, they have a lack of minerals because minerals do mineralize the teeth through saliva. So we want to make sure they have an adequate intake of minerals.
Yeah.
In order to mineralize the teeth.
That makes sense. Raman has a question here. I had my amalgams removed about 6 months ago. One of them got a micro crack, not near the gum line, but it's still sensitive to cold and chewing after we finally put a crown on it. How long should I wait until the next step? And what is the next step? I've done a CT scan, thermography, and ozone shots.
Yeah, so it depends how deep that crack was. And it's good that you put a crown on it. That's definitely good. Again, my tooth took 6 months to finally completely go away. So there's some great homeopathics out there that you can do also for inflammation. And Guna Osteo, there's a company called Guna that I like. But they have something for broken bones, which teeth are bone, by the way, right? So Guna Osteo and Guna Flam. So you can try some homeopathics for this tooth and see if that will help you.
Mouth taping and sleep. Let's talk about sleep and teeth, because there's all sorts of, different gadgets that people are wearing overnight, the mouth taping now. Like, let's talk a little bit about sleep and teeth and oral health.
Yeah, I mean, sleep is such a big problem because a lot of people don't sleep well and they have sleep apnea. So what is sleep apnea? It's basically not getting enough oxygen at night when we're breathing or sleeping. And it's easy nowadays to do a sleep test. So if that's one thing, that you can do is recommend people to get a sleep test, especially, I don't know if on your intake form, you're asking questions about sleeping.
Right.
Oh, great. Yeah, because it's a huge factor of healing. Yeah. So we actually do sleep tests at the office, and probably you can do it too with a night owl. It's a index finger sensor that our patients tape to their finger for 2 days in a row. We actually work with a company called Sleep America. So they actually give us the report, and you could tell if somebody has sleep apnea, whether it's mild, moderate, or severe, but just from that sensor. So you no longer have to go to the sleep center, get all wired up. It's so convoluted. So we can get a lot of information. And the good news is, as dental professionals, we can either do a dental appliance. They can get a CPAP, of course, with their medical professional. But the problem with CPAPs, they're only about, 78 to 80% successful. Dental appliances only work for up to moderate sleep apnea. But there's a new technology now from Fotona Laser Company that actually were able to modify the back of the throat to lift the soft palate and shrink the tongue in the back. So it's 89% successful in basically getting rid of sleep apnea and having people sleep better. And it doesn't involve any cutting, which is the best part about it. We don't even need to numb. It basically, the laser helps to liquefy the fascia, and it helps to shrink the tissues just by warmth. Wow. So it just creates a warmth and it opens up the airway.
Incredible.
It's called night lace.
Night lace.
Yeah. I was a dentist, Dr. Schiffman from Florida. He invented this technique about 7 years ago. And finally, he's coming out with studies. It's pretty amazing. So I ended up buying a laser last year and doing night lace therapy because I don't have many other things to offer people that can't breathe, except for appliances.
Right.
Yeah.
Cindy's asking natural alternatives to Botox and mouth guard use for TMS.
For TMD, for like temporomandibular joint disorder, is that what? I don't know what
They wrote
TMS is.
TMS, but
Probably TMD or TMJ, maybe.
yeah, that's what I was thinking. TMJ. Yeah.
Yeah. So TMJ issues, what does that mean? The temporomandibular joint, which is right in front of the ear, a lot of people, 50% of people have some kind of clicking, but then it could be, for a small percentage of those 50%, it can be painful and it limits their opening. So those are the people that we're really looking at. Okay, why is this happening? Again, a CT scan is necessary to see where the disc is. We can't just do Botox before we know what exactly the problem is. Is the disc displaced? Is it a loose ligament? Maybe we need to correct the bite first. But for people that are really clenching, that are causing popping and clicking, Botox is a solution to loosen up the muscles in order to prevent the clicking. There's also peptide injections that are helpful. VPC 157 is one of them to help to loosen up the muscles and help people with headaches, because that's one of the things that we see. People that are clenching or have TMJ, they also can have headaches. When that's very difficult. And also red light therapy. That's a simple thing you can help your patients with. They can buy nowadays. Red light are basically $100, $200, and those can be effective in loosening up, the joint and the muscles of mastication, as well as the neck.
So you're not talking about the ones that people bite into, just the red light, like on the outside.
On the outside. I'm not crazy about lights on the gingiva.
Okay, tell us more about that.
Especially the blue lights. There's some companies out there selling blue lights. Because there's a 3-day turnover of the gingival cell, the cell, the gingival cell. So blue lights have also been associated with DNA damage.
Interesting.
So, I don't think, until we have more research that they're safe, I don't recommend to use them. I think it might be safe. We just don't know.
Right.
But I think the less lights we put on the gums, probably the better.
Okay, that's actually really good to know, because you're right. There's a lot of companies that are now, there are a lot of companies who are promoting that pretty actively as teeth whitening and reducing inflammation, etc. So that's interesting to know. There isn't necessarily the research there to support it.
Yes, that it's safe. Exactly.
Okay, gosh, there's great. It looks like most of these questions have been.
Somebody was asking about gum recession.
Yes.
So number one, I always like to see what does the gum recession come from? Are the gums thin? Are the gums thick? Typically, as we advance in age, we get thinner gum tissues. But a lot of people, we categorize them into thin, biotype, average, and thick. People with thin biotype or thinner gums have more worry that their gums are going to recede. What does that mean? You start seeing the root of the tooth, and that can become sensitive.
Yeah.
People that have had braces typically will see more gum recession because the teeth kind of have been aligned sometimes out of the jawbone. So when you see gum recession, you still have to clean it. The worst thing you can do is not clean it, thinking that by not brushing it, it's going to get better. It's actually not. It'll make it worse, because if plaque sits over that root surface, one, you can get a cavity there, or you can actually get more gum recession from the inflammation. So definitely brush the areas of recession. You don't want to overbrush them, small circles. I think taking collagen supplementation is important, especially if you're seeing, as you're getting older, that your gums are receding. Collagen is hugely important. And we do have different ways to augment the gum. If the recession is over 3 millimeters, then I recommend, and the recommendation of the American Academy of Periodontology is to graft. Why? Because as gum recedes, so does the bone. And we're trying to maintain the bone.
Right.
So up to 3 millimeters is okay, but if you're starting to get more than that, how do we augment the gums? So we have different options. The traditional way is using your own gum tissue. We actually take it maybe from behind the upper teeth somewhere, and we graft it in the area where we need to. But we can also use a donor tissue basically from cadaver. And we have tissue banks that we actually get that tissue in order to graft. The more recently, I've been using actually platelet-rich fibrin, or PRF, where we draw blood from people, we collect the growth factors and fibrin, we pat it down, and it literally gets shaped like a gum tissue. That's what it looks like. And then I can actually tuck it in to thicken up the gums that way. So that's kind of like the least invasive, more biological method that we have today.
Fascinating. Fascinating. Wish I still lived in LA. I would be coming and being one of your patients.
I'd love to see it.
This is really helpful. Thank you so much. I'm going to give, you've included a couple of great resources here for folks, and I'm going to pop into the chat. And we're going to also make sure that we include these. And I can see folks asking for the, I can see folks are asking for transcripts, which we will make sure that you can get. I know there's been so much great information here. So I just did there's a great book. Maybe Dr. Sanda, you can just explain a little bit the Detoxify Your Mouth. You said you have a great ebook here. And then I'm putting in the 20% off for Orasana's probiotics for if you use the code RWS.
Yeah, so I also put somebody asking what kind of scan, and I put it here. It's called a cone beam CT scan. In this booklet is like there's a lot of information probably that we just kind of hit the surface. The Detoxify Your Mouth, it just goes into more detail, like how we treat the microbiome, what are root canals, what's the right way to do an extraction, about maybe ceramic implants. I know we didn't get a chance to chat about that. So yeah, it's just more in depth on how to remove mercury safely and all of this.
Wonderful. Well, I could talk to you forever. There's so many great, this is such it's its own world, and it's so fascinating. Thank you so much for sharing with us this evening, this afternoon. Really invaluable. Appreciate all of your expertise.
Yes, it's my pleasure. And, I have a podcast, the Holistic Dentistry Show, if anybody wants to hop on there. And there's some great information on oral health.
Awesome.
Or I have my YouTube channel. If you want to see some surgeries, you can go there.
Oh, you actually film the surgeries?
I do. I actually have a video that we found parasites in the cavitation site. And literally, I was pressing on the gum, and there were these squiggly gray things coming out.
Goodness.
And luckily, I had my camera close by, and I did record this.
Oh, my goodness. Parasites in the oral cavity. Oh, that's something. Do you see that a lot?
Quite like this was more of a special case, but I do biopsy every cavitation site. I've never seen it sterile, but it's about 70% of the time there's parasitic activity.
Wow.
Yeah.
That's a lot. I'm getting questions here for the link to the biological dentist directory. So you said IAOMT.org, correct?
Yeah.
Okay, there we go.
I'm also answering some things. The laser for sleep apnea is called night lace. If you Google night lace, that's the name of the procedure. You'll find a lot of information on that. Okay.
Well, thank you so much, Dr. Sanda. This has been fantastic.
Thanks for having me. It was a pleasure.
Thank you, everybody, for joining tonight, for your great questions. I don't know that I've seen the chat so active in a long time. This was wonderful. This is a hot topic. So thank you so much.
All right, my pleasure, everyone. Have a good night.
Have a great night, everybody. Take care. Goodbye.